So you're wondering about the PSA test for prostate cancer? Well, in this video, I will show you why this test is highly unreliable and exposes men mostly to scare tactics, false promises, and health dangers. So stick around and be informed. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options so you can be informed and in control of your healthcare decision making. If this is your first time here and you want to know about routine medical conditions, go ahead and subscribe below and tap the bell. We get contacted by patients, employers, and providers regularly looking for ways to ease their healthcare burdens. So feel free to reach out, send us an email, or hit the comment section below. So let's get into it. We've made some tables summarizing what we're going to talk about so it's easier for you to follow. By the way, we will add the links to all the material in the description below. But before we do that, we have to inform you about the disclaimer and that the information provided by HEALTHdrum is for informational and educational purposes only, and that you should consult a licensed physician for medical advice, diagnosis, and treatment. So read the disclaimer. So let's talk about the PSA, or prostate-specific antigen. The word specific here in this label is a barefaced lie, as the PSA is not specific for the prostate or even prostate cancer. The PSA is highly unreliable with a false positive rate of about 78%. Its limits of 0 to 4 being normal are made up and absolutely meaningless. The PSA can easily be raised or lowered by numerous benign processes and medications. The next table underscores even more concerns about the PSA. An elevated or high PSA doesn't necessarily mean you have prostate cancer. In fact, a high PSA usually means a big prostate. Furthermore, lowering of a high PSA doesn't mean you have less or no cancer, and the PSA cannot distinguish between aggressive and non-aggressive cancers. This is important because most prostate cancers do not cause death. Only the 10 to 15% of high-grade aggressive cancers are potentially deadly. However, these can go undetected as these aggressive cancers commonly produce little or no PSA. So clearly the PSA doesn't even meet the criteria for being a useful screening marker for prostate cancer. But let's examine the PSA test further. The question is, are physicians delivering recommendations that are safe and effective, or are they simply recycling misinformation? Amazingly, urologists' own clinical studies concluded in 2009 that PSA testing failed to save significant numbers of lives. So here's a screenshot of that paper, mortality results from a randomized prostate cancer screening trial. So let's review once more why the PSA test is so highly unreliable and why physicians and healthcare oversight agencies have failed to protect an unwitting public. Further details can be found in two great books, The Great Prostate Hoax and The Rise and Fall of the Prostate Cancer Scam. Both of these will have links in the description below. So let's look at this table titled The Unreliable PSA. Not only was the PSA test highly unreliable with a false positive rate of 78%, but despite urologists being fully aware that this test was not safe and effective as a screening tool for prostate cancer, the urology community labeled the test as standard of care and includes the test in their guidelines. Even more troublesome, they helped engineer an FDA approval for this test in 1994. Yet, despite the many issues with this PSA test, only one healthcare agency was concerned about patient welfare. The USPSTF, or the United States Preventive Services Task Force, an independent evidence-based organization of highly respected physicians, gave PSA-based screening a D grade in 2012 as the benefits of PSA testing and the treatment of screen-detected cancers did not outweigh the harms. However, this important healthcare safety ruling was quickly challenged by physicians and others in the business of prostate cancer, and the rating was watered down to an ineffectual C grade in 2018. Amazingly, there is no irrefutable or reproducible evidence showing that the PSA test or any other test for prostate cancer saves significant numbers of lives. Yet physicians continue to recommend this test, label it as standard of care, and include it in their medical guidelines for localized prostate cancer. As a consequence, serious harm is done to countless men, and billions of precious healthcare dollars are wasted each year. This video explained why PSA testing for prostate cancer is highly unreliable and a danger to health. To learn more about the safety and benefits of routine medical tests and treatments and cash pay healthcare options, check out these videos.